All right. Thank you everyone for being with us here today. We're really excited to be presenting to you. My name is Jill Bunge. I'm the Vice President of Impact and Outreach at United Way of Greater Toledo. And we're here to do one of our quarterly 2-in-1 trainings where we'll give you a quick overview of the service, some of the functionality, and then we have some excellent partners today. We're joined by 4 folks from across Lucas, Wood, and Ottawa County to talk about workforce resources for both employers and job seekers. So thrilled for them to be spending their time with us today and sharing their expertise. So we'll get started. We're going to hold all questions for the very end. Everybody will be muted upon entry, but you'll be able to unmute yourself if you have any questions, especially for our presenters at the end of the presentation. So again, I'm representing United Way today. I'm also joined by Emily Ruckel, the Vice President of Technology and Remote Operations at Griffin Place. And then we also have on the line our 2-in-1 Director, Sandra DeSteno. Want to do just a quick thank you. Really grateful to our 2022 training sponsors. MedMutual is our presenting sponsor and Aetna our supporting sponsor for 2-in-1 trainings this year. So we'll kick it off with a quick poll just to get a sense of who's in the room and some of your past utilization of 2-in-1. So Sandra will launch that, and if you could respond to those questions, we'll give you just a minute to do so.
Is the poll up?
It hasn't come up yet.
Oh. There we go.
It's still not coming up for some reason.
I can see it. Can no one else see it?
I can't see it either.
I can.
You can? Oh, good. Well, if the poll is visible to you. Super. Sandra, just let me know when you want to look at the results.
Yep, it looks like everybody's fine in the poll now. We are at about 50% participation. So we'll give it just another couple of seconds for everybody to weigh in. If you click your Zoom controls, sometimes it hides, so you can bring that up and answer our polls. We're at 75%. And we'll go ahead and close that in about 5 seconds.
All right.
Here are the results.
Excellent. Thank you so much. So our first question here is, when was the last time you called, texted, or chatted 2-1-1? And Sandra, I'm not seeing the results. Could you weigh in on those?
So it looks like we have our largest percentage is I've never contacted 2-1-1 at 48%. In the last year, 32%. In the last 6 months, 3%. In the last 30 days, 10%. And in the last 7 days, 6%.
Excellent. Thank you so much for sharing that out, and thanks all for taking the time to participate. Well, we hope after this presentation that those of you who have not utilized 2-1-1 are encouraged to do so. Good for us to get a bearing of the utilization of the service by folks on the call today. So wanted to give just a general overview of our 2-in-1 internal structure and how we operate locally. So as I said, we have our local 2-in-1 director, Sandra. We have 2 program managers, Emily Matthews and Nautica Kucher. We have a senior resource advisor. We have 2 coordinated entry specialists who help people get connected to emergency shelter. We'll talk about that in just a moment here. And then we have 15 local community resource advisors. These are the folks who are picking up the phone phones, responding to chats and texts. And then we also have some strategy and communication support from myself and Emily, comprised of a really wonderful team. So, we always start here. 211 as a whole is a free, confidential service that helps people across North America find local health and human service resources that they need 24/7, 365. 27.8 million connections were made through 211 in 2020. 96% of the United States is covered by some incarnation of the 211. We actually, since COVID, have 100% coverage in Ohio. So there were a few floating counties that weren't quite covered prior to the pandemic, but during that time, some of the additional 211 service providers mobilized and were able to make sure that at least basic emergency, a smaller database was covered to ensure that folks could call and get connected. And over 20 million contacts are answered annually. And who are we connecting to? So again, the information and resources that we're providing really span the whole landscape of the health and human services sector. So we provide referrals like the ones that we're going to talk about today for job training opportunities, your basic needs, food, clothing, shelter, child and elderly care, financial and legal assistance, specified health services, substance abuse services, really anything under the sun, from local to state and national resources, but a big emphasis on local. We are able to reach out, folks are able to reach out 24/7 and contact us anonymously, and we'll get them connected to the things that they need. So I'm going to pitch it over to Sandra to talk some more about the special projects through 211.
Thanks, Jill. I'd like to start off by talking about special projects that 211 has undertaken. I think that these really highlight the versatility of the program and our ability to assist with community needs. Many of these response mechanisms demonstrate the capacity that 211 has for being the point of entry into critical services needed by the community, and the capability to respond in real time as these needs arise, particularly in times of crisis. We hope that by highlighting these capabilities, we can continue to find ways to partner with other service providers and to help them accomplish their work in the communities that we serve. So as you can see, we do have a couple of special projects here. Our first example is holiday assistance. We connect people who call 211 to a variety of different holiday assistance programs that happen in the community. We've done that for many, many years. But in 2020, as we were tracking needs and unmet needs in our community, we learned that holiday assistance resources were fewer and fewer supply and were being exhausted faster than usual, most likely due to the pandemic. We were able to quickly implement and launch a plan. United Way provided funding to purchase gift cards, and 211 took 375 registrations for 333 families and 23 individuals to provide additional help around the holidays. Another need that arose in the community was related to supporting one of our local community partners. Lucas County Job and Family Services received a COVID allotment of prevention, retention, and contingency. I always trip up on that, otherwise known as PRC, funds to provide direct cash assistance to families. Because of the volume of requests that they already handle across their agency, they tapped 211 to take applications, collect documentation, and submit approved applications, and then process those payments for families. We are currently wrapping up this current PRC project. It has been running for the past 8 months, and it will culminate in dispersing $1.3 million into the hands of Lucas County families. Every year, we partner with LISC to schedule over 3,000 tax preparation appointments through VITA, the Volunteer Income Tax Assistance Program. Individuals call 211, or they can go to our website and schedule online to meet with a volunteer tax preparer to get their filings completed. And when it comes to disaster service, we are able to respond quickly. working with agencies to develop a crisis plan. A couple of examples of that are when the pandemic first hit, 211 worked with Connecting Kids to Meal providers to set up a reservation system so that we can ensure meals were available in the right quantities at different meal sites. We've assisted the health departments in Lucas, Wood, and Ottawa counties when vaccine coverage rolled out, and we'll look at some of those stats later. And in the past, flooding in Port Clinton, the water crisis in Toledo, and other similar emergencies, we're able to mobilize those services very quickly. One of our biggest programs that we do is our Coordinated Access Program. 211 is the entry point into the Lucas County continuum of care services for people who are at risk or experiencing homelessness. When someone calls 211 and they indicate that they are at risk of or experiencing homelessness, the community resource advisor fills out an intake so that they can connect that person with our coordinated access staff. From there, the coordinated access specialist works with the person to explore immediate resources and options. Our coordinated access department has a running bed count of 4 major shelters in Lucas County: La Posada, Family House, Beach House, and St. Paul's. Each of these shelters takes single females, single males, or family units as they have beds and rooms available. The coordinated access specialist will assist with intake into shelter. And in the event that no shelter beds are available, we also manage the waiting list to get into shelter when space opens up. We provide referrals to additional shelters outside of our network as well that don't take referrals directly from us. Coordinated access works off of a prioritization-based waiting list for families and individuals. This process we've found puts less of a burden on the client while allowing us to collect and report out on specific data to the community. We have been asked to provide this information to organizations like TLCHB and LMHA, as well as reporting this information to the community via the Community Advisory Council, which is part of the Homelessness Board structure. I'd just like to point out a couple of other programs that are available through our CA program. We have launched 2 programs in partnership with TLCHB, housing problem solving and also eviction prevention services, which helps to get more resources at the front door when we're looking at people who are experiencing or at risk of homelessness. In the last 6 weeks of eviction prevention since it kicked off, of the 37 intakes that were provided and worked on with 211 and the Homelessness Board, 36 of those 37 intakes were able to successfully prevent evictions. So I'll now hand the presentation to Emily, and she's going to talk about our resource database.
Thanks, Sandra. All right, so first thing before we pop into the database, could we look at the results for survey question 2? So the question was, when was the last time that you searched for resources using our public database? So it looks like, oh, let me scroll. It looks like 42% have never utilized the database, 16% in the last year, 16% in the last 6 months, 10% in the last 30 days, and 16% in the last 7 days. So the next couple of slides, we are actually going to talk about the database in more depth, what we have in the database, and then do a quick run through of how to utilize the database on your own. So in addition to being able to call 211 and talk to someone, you can also search for resources yourself in the online database. We have over 800 agencies listed who administer over 2,300 unique programs. Most of these are local agencies, but we also have information on state and national service providers. And when we put this information into the system, we are collecting as much information about the agency, the location, the access, about the program, how to access the program, what documents you might need. We're getting all of that information into the system so that when we provide that referral, a person is going to have everything that they need in order to access that service. We do have dedicated staff. We have both 1.5 FTEs that work in the database. And then we also have a resource manager that oversees the entire process. And these staff are tasked with keeping all of that information as up to date as possible. So once annually, they're going to send out a reminder to every agency in the database to ensure that that information in there is correct. We're also updating, throughout the year. Agencies who are listed in the database can log in to the website and do a self-update. If their hours change or if they have program information that's changed, we highly encourage agencies to go in there and just update that as that's happening. And then our call staff are also reporting back new information or corrections that they might get from callers or community feedback. And so any correct listing is then reported back to our database specialists, and then that change is made. So next we'll go through a quick demo. So you're going to start off to access our online resource database by going to our website, 211nwo.org, and clicking that blue Search Now button. There are 3 different ways that you can search the system. So first, you could search by keyword. So here you could type in like food, or you could type in support groups if you know exactly what you're looking for. Secondly, you could search by agency name or program name. So here you could type in Red Cross or YMCA. And then lastly, the system does have a built-in guided search. And I'd say that by far, this is really the most common and the most recommended way to search the system unless you know exactly what you're looking for. So you can see that there are lots of different categories here to choose from, such as housing and utilities, volunteers. But in this example, we're going to be searching for a food pantry. So first, you're going to enter in that zip code. We're going to use 43604. This is going to auto-populate the city. You can enter age and gender, but these are not required fields to search the system. From there, you're going to scroll down and select the category. So here we're going to search food pantries. So we'll select clothing, food, and personal items. It's going to bring up a variety of subcategories such as community meals, food pantries, or even pet food. We'll select the food pantries. And from there, we're going to get a list of pantries in proximity to the zip code that we entered. So you can see here, we have a variety of options that have populated with the agency's name, their address, phone number, all that contact information. And you can also see basic information about the food pantry service. So to get more specific information there, you're going to click that blue See Details link. This is going to provide further information such as service description, eligibility, hours of service, documents required, fees or costs if there are any. Excuse me. And then while you are here, you can also see down below the services that additional services that are available at that agency. Lastly, I just want to point that you can print, email, or text those resources. All right, from there, we are going to jump into stats and community data. And we're just going to take a quick look at some of the high-level stats and the top requests, and also explore our 211 counts page. So as you can see from these 2 images, over the last 4 years, 211 has seen a steady increase in our call volume, with 2021 really reaching unprecedented numbers as a result of thousands of contacts that we received seeking information regarding COVID vaccines and COVID testing. We did anticipate that the volume for 2022 would be less than the prior year, and currently we're projecting that to land somewhere around 80,000. On the right, the graph on the right, we have a look at the last 35 months of contacts offered and handled. And just a quick point, the difference between offered and handled are those that called or tried to access 211 versus those that actually spoke with a CRA via call, text, or chat. And so looking at that graph, you can see that we did see a really small spike back in March of 2020 during those early days of the pandemic. And then it was really a relatively steady amount between April and December of 2020. And then those three very large spikes right in the middle of the graph, that's January, February, and March of 2021. And those contacts were primarily, those high volumes were primarily the callers seeking information about vaccines and appointments, vaccine appointments. So as those vaccine calls became less frequent, as vaccines became more widely available, the volume did begin to decline around April of 2021. And then these higher volumes that you're seeing really in the last 6 months, that's partially due to the PRC program that Sandra talked about earlier. Here's a quick overview of our 2021 stats. So last year we did have 104,000 contacts to 211, which was a 53% increase compared to 2020. On average, each day our staff are taking 275 contacts a day. We received 2,800 contacts from veterans or active duty households, 22,000 contacts from households with older adults, age 60 and older, and we served over 15,000 contacts with minor children in the household. Lastly, in the area of stats, these are our top requested services through 211. In most years, housing, shelter, utilities, and food, they always reach the top 3 requested services. But as of 2021, COVID was also very, very high on the list. And this included, like I mentioned, calls for vaccines, vaccine appointments, testing sites, or just people seeking general information about the virus. And so it has reached, as of 2021, our top requested services. So if we can pull up the results for that last survey question we asked, which was, when was the last time you visited our 211 counts page? So we have an overwhelming majority here, 74% have never visited 211 counts, 13% in the last year, and then equally split between the last 6 months and last 30 days, 6% each, and no one recently. So we will take a quick look at what 211 counts is, and then we would definitely invite you all to go explore that afterwards and give us some feedback. So if you've previously contacted 211, you know that we ask each caller a few standard questions. We're going to ask about the zip code of the person in need, their age, etc. We also keep a record of all the referrals provided during each of those contacts. And really one of the most powerful facets of 211 is that data that we capture from the contacts with community members. We are able to animate this data through an online publicly accessible dashboard, which shows the total number of contacts made, top requests, categories of need for people contacting 211, geographic information like zip code and county, congressional district, as well as their demographic information of age and gender. So at a glance, really, this information can be a resource to get a pulse on community needs. And it can also be used for grant reporting or to advocate to elected officials. In addition to that, information being reported out, we also track unmet needs. So these are the needs that are not met when someone calls. So that may be the need to, or the service just does not exist in the community. It could be that the individual doesn't qualify for the service, so we're unable to make that referral. Or it could be that the information, we just don't have that in the database. But regardless, this really allows us to better understand what barriers people are experiencing to getting services, and also sheds light on emerging needs in our community, and so that service providers can really rally around those needs. So next, I'm going to pass it back to Jill, and she's going to discuss a little bit about what makes 211 unique in the world of navigating health and human services.
Thanks, Em. So this is the question that we pose to ourselves, to external folks. Why not just Google it? Now that we've covered the basics of 211, some of the more nuanced features, we hope that the answer to this question is apparent. But 211 really provides a comprehensive information and referral service that's specific to our community. So, when something that we cite when individuals may ask that, we want to make sure to convey that, as many of you know, the health and human services landscape is very, very complex to navigate. It's challenging, it's time intensive, it's labor intensive, energy intensive. So, 211 really has some attributes that set it apart from just doing a basic search and putting that burden on the client or the individual who may be in need of assistance. So 2 final points on here, the accessibility of 211. 211 is available to everyone in our community. So in order to serve individuals with limited English proficiency, we have language access services on both our community resource database through Google Translate, and we have translation services over the phone. So if an individual is calling into 211, they speak a language other than English, they just communicate their preferred language. Our community resource advisor will dial in language line, usually a fairly quick turnaround on that. And then all 3 of them will be on that phone call and be able to access those translation services. Additionally, if the referral that we provide to an external agency, if they don't have someone who is able to do that translate, we can then phone in that 4-way call to make sure that the translator is available to the client as well. And just to let you know too, we also have marketing materials not only available in English, but we also have them available in Spanish, Mandarin, and Arabic. Those are available on our website, and we're also happy to send digital versions of those upon request. So finally, before we kick it off to our wonderful guest presenters today, asking the second question, this is, in my mind, perhaps the best illustration of how 211 is different. It's the human element. 211 navigation is so critical, and making sure that we're approaching these conversations with compassion, empathy, and understanding. I will say that we really saw how important this was during the pandemic, particularly with the vaccination efforts, with older adults calling so frequently. Quite simply, people wanted to talk to someone. It was a very scary and isolating time. So it was so important for us to make sure that we were showing up and guiding people through, finding their needs, but also just being that listening ear and communicating in a way that the individual on the other end of the line needed to be communicated with. So the 15 CRAs who are working with us, a lot of them have experience or backgrounds in social work or health and human services, but we're also providing them training to ask that secondary question, which really helps us understand more comprehensively the bigger picture of what's going on in their life, so that we can then provide the best suited resource navigation for them. Maybe we can provide them with additional resources beyond what they were initially calling for. Sometimes services that they are calling for might not be available. So in this example, we have someone who needs help with a car insurance payment. So we might not have an agency in our database that can help with that specific need. But if we dig a little deeper and find out what's going on through that conversation, the caller says that they recently lost their job. So how can we provide them with a food resource so that they can go to a food pantry to tide them over, and then connect them with those job finding resources? So in this example, we would probably direct them to call some of our guests. So we're so excited to, have this deep dive into workforce resources today. And we're going to kick it off with our 2 presenters who will go back to back. In Lucas County, we have Darlene White from Ohio Means Jobs, who will then be followed by Burma Stewart from the Department of Planning and Development. So I'll hand it over to Darlene to begin.
Thank you. Appreciate being here today. My name is Darlene White. I'm the program manager for Ohio Means Jobs at Lucas County. And we're new to the One Stop. Most people refer to it as a One Stop, but the other name would be the American Job Center. And we're currently located at 3737 West Sylvania Avenue in Toledo. We're near the Franklin Park Mall. I usually use the landmarks Notre Dame Academy and the Franklin Park Mall. And it's our shared campus, which I think is really a unique circumstance that we have here, because we're paired up with other helping agencies, Jobs and Family Services, as well as child support, Board of Elections, Workforce Development and Planning, our office here, which is Ohio Means Jobs. So it's an opportunity for most individuals in those circumstances we're talking about to look for employment, and we're like a one-stop shop. So when people come in, they know that if they're looking for work, they would be able to come into the location and come right back to our resource room. So this is where the rubber meets the road and the business community with the local employers and job seekers. This is where we learn about job openings. And when people come in that are looking for jobs, we have information that can assist them with that process of finding the ideal job that they might be looking for, or even possibly learning to train for in the future. So I think the primary goal here is where if you need a job, you're going to be able to come to Ohio Means Jobs to obtain some sort of service that will get you to that destination point. So the resource room actually is equipped to hold 30 computers in it, but due to social distancing now, we have 15 in our main resource room. And then we also have a youth resource area that has approximately 10 computers. And then there's a computer lab that we use to assist Owens Community College and Penna with their GED classes. And then we do testing for any type of training program that we could be working on. If, let's say, for example, an academic provider needs to see where a person's at with their reading or their math comprehension, or even a business that's looking to get some sort of idea of where the person falls on the level of comprehension and ability for a specific job. So we have the ability to simultaneously do all of these things. There's enough room for people to come in and feel comfortable. And then with the other types of things we have available, for example, would be if someone just needed to come in and make copies. We have, with our shared partners here in the building, there are individuals who might need to, get some documents copied or faxed. Our staff is always willing to help because they may need it for some instance for 211 assistance with housing, or maybe going to food pantry. So they need to bring in some collateral documentation, I call it, to support their need or their financial situation. The other things that we do here, I'm going to move the slide on, is that we host workshops. So for example, if someone were to say, oh, I'm interested in getting a job and I might need a resume. Well, we do have workshops available for people, from the orientation to what the center provides, because we have a number of partners that work with us here. So we're able to orientate them to the services, the partners and the services they provide, along with different tools that are going to help them get to that next destination of securing employment. So for example, we have a calendar that's available. We're posting that on the website and also on our Facebook page, where it's evolving, because as we're new here, our partners are coming on. Some of them have been with us a while, and new partners are also helping to build our I call it our collateral here, where we are able to provide more services, other types of services that will be beneficial to anyone that's walking in the door. So going back to the workshops, there would be orientation, resume development, practicing for interviews, looking at the skills, soft skills that are necessary that will help you to land a job, that what employers are looking for in the community. And then also how to go about looking for work, because now with technology, everyone is pretty much isolated from, being able to do a cold call and just walk in somewhere. Networking, of course, does help, but technology today is the way people are, sorting through their applications and resumes to try to find candidates that are potentially going to be a good fit. And then, of course, always looking at the individual where they're at, because we are, I would say, when we look at compassion, understanding, and empathy, as Jill had pointed out, that's where we're at here. We look at an individualized approach to everyone that walks in the door. So we want to see what someone brings to the game, so to speak, the job game, because we want to identify what abilities they currently have and how to expand on them. We're dealing with a number of people who are in underserved types of situations where they may feel somewhat defeated. The last job they could have had for a number of years, they never advanced in their education, and now that company is rolling up the carpet and moving somewhere else. So what we want to do is be encouraging and identify the strengths of people and build on those. So I want to emphasize that, that we're taking an individualized approach to working with individuals. One of the other things that I'm not sure people are aware of, we're classified as work ready Lucas County. This is where we are working on tutorial systems that can help in proficiency in math, workplace documents, and graphic literacy. It's through ACT, ACT, and these are opportunities for people to earn credentials that can assist them with employment. There's over 300 employers locally that for at least the last 5 years have been a part of this. I want to call it a community of work ready. And we still provide this service. People can come in, and I say for some that maybe haven't even had a high school diploma, but there's many people that haven't graduated from high school that are just like brainiacs, that if they were to take this particular curriculum, they might score beyond a college level. So for that person that's interested in getting work right away, yeah, we would encourage them maybe to look at a GED, but an employer might say this particular document could be helpful for them in their industry. So we encourage people, there's a bronze, which is the lowest level, and it goes to platinum. And I think that, if anyone's ever interested in or knows someone that might be looking for a way to sit down and attain this, you can, have them call us and we can set them up for what we would call a proctored exam. The other thing that we do is we work in tandem, and I know Burma's going to touch on this, is the possibility of training. We're working with businesses today that are looking at the future and in-demand occupations, how these gaps are going to be filled. So we work in tandem with workforce and development, and I'll let Burma handle that part on training, because I think this is where we combine our forces of, identifying people through testing and helping get documentation on their eligibility that we can move along to other partners here in the building that can help establish whether or not they are eligible for the variety of training programs that are available in our community through, different academic institutions. And then, of course, employer services. We work hand in hand with employer services through workforce development, because we've got to be able to meet the road between the job seeker and the business. Want to bring them together so that employers can take a look at, who's available in the marketplace, what are some of the skill levels that they have. And we actually had a job fair, it was May 6th, and we had 40 employers here in our wonderful new building. If you haven't seen this place, it is pretty impressive. We had it in our atrium, which I think everyone was just surprised by the outcome. And we had over 129 job seekers show up. And it was a good day for everyone. I really felt like we had hit the mark in giving employers what they needed at this particular time, because obviously, as you know, many jobs are being advertised and sometimes people are not even showing up. But that day proved that people were looking for a sustainable income. Every employer we had on the campus that day had to demonstrate that they were capable of paying more than $15 an hour. And I think, this kind of got things back in the groove, because being shut down for so long, I don't know how to explain it. And I know that many of us have all gone through this, like, how are we ever going to get back to where we were? But we're learning things to do differently. We're learning more about businesses, what they're looking for, and how to be available to them in a way that is going to make this relationship stronger. So if, for example, if someone's calling and is like, at their wit's end, like, let's say something happened, today, they got a pink slip, or there was just an unfortunate circumstance, and most people would be like, I got to get back to work. Someone might be thinking, well, I better apply for unemployment. But if they call 211, please suggest that they call 419-213-567 jobs, because we would like to be able to get them in, talk with them, determine what their need is currently, and hit the ground running. So I hope that through our relationship, we're going to be able to, pave the way to helping people identify their strengths and that they can have a sustainable income and be prosperous here in our community. Thank you for your time.
Thanks so much, Darlene. And we'll turn it over to Burma.
Good afternoon, everyone. I am Burma Stewart. I am the Deputy Director of the Lucas County Department of Planning and Development. I'll give you a little bit of background or history on our department. Currently, we have about 18 staff members who provide services that promote economic development, enhance business services, and training opportunities. And we also do our own program monitoring. So everything that we outreach in the community, our goal is to make sure that we're monitoring that to ensure that we are delivering the services that as expected. So the Workforce Innovation and Opportunity Act is really what grounds the Department of Planning and Development. We call it WIOA. It was established and enacted in 2014 under President Obama, and it is made up of three programs. The WIOA Adult Program currently serves individuals who are 18 years of age and older. The program helps individuals obtain employment by providing them with job search assistance and training that will enhance their skills and lead to what we call an industry accepted credential or certification. We work in tandem with, as Darlene said, OMJ on the job search assistance to help individuals once they've gone through the training to, get that job that's going to make them self-sufficient, in the community. Our goal is to provide opportunities to individuals, as I said, to obtain employment in what we call an in-demand job field. And I'll talk a little bit about what's considered in-demand jobs a little bit later in the presentation. The WIOA Dislocated Worker Program is also for adults, but it's designed to help workers who are what we can call dislocated as a result of a job loss, a mass layoff, or a job transition, get back to work as quickly as possible. In the program, individuals will work with a case manager to identify barriers and overcome those that are preventing them from gaining new employment. Sometimes that can result in needing additional training because their skills may be outdated. It could mean maybe they just need to have a better transition into new employment and helping them find those employers that can best utilize the skill set that they have. But again, our goal with our dislocated worker program is to get them to re-enter the workforce and continue to contribute to the community and sustain the lifestyle and livelihood that they have. And then our third program is the WIOA Youth Program and the services that go along with that. We call that the CCMEP program. It is designed to serve youth who are 14 to 24 years of age. And this program is currently administered through Harbor under a Department of Planning and Development contracts. So it's not something that the Department of Planning actually provides, but again, we contract with Harbor, who oversees and provides those services directly. So the types of services that we offer, as Darlene said, most of our career services, again, that's relating and centering around job search assistance, is going to be housed in the OMJ Center. So she spoke a lot on what they offer there. I'm going to focus more on our training side, which is what the Department of Planning and Development is responsible for. So some of the products that we offer are individual training accounts, or ITAs, as we call them. They provide funding for schooling and training to assist individuals to become self-sufficient. So we see individuals who may be homeless, who may be unemployed or underemployed, coming to us, reaching out to through OMJ, and then getting directed to us for additional training so that they can enhance their skill set or their financial situation. ITAs are only approved, however, for training courses that are on the workforce in an inventory and education and training list for the state of Ohio. That is a state-sponsored website, and it's a website that all training providers are required if they are hoping to utilize or receive WIOA funding, they have to be registered and approved on. Programs of study can be identified for careers. They have to be on the Workforce Board's approved demand occupation list. And you can find this list on the county's website under workforce policies. If Jill, your team needs that website, I can shoot that out to you after the presentation so that you have that direct link. But it is on the Lucas County workforce policy site under the Lucas County, The next type of product we offer is what we call an incumbent worker training agreement. This is where we are working directly with employers to help them with their training needs. And this is offered through our business services unit. It's designed to meet job requirements of a specific employer or a group of employers. So a lot of times we will see the employers requesting this type of product when, let's say they have, they're trying to upgrade or modernize their industrial operations. So if they have a new line or maybe a robot or mechanical line that they want to install in their facility, but they need to train their workers on that equipment. Many of them will reach out to us and say, how can you help? And we can often help by supplementing the training costs and the costs of those employees during the training period. This really helps the employer by allowing employees to continue to work, but also upgrade their skills while they're maintaining employment. Our next product is the on-the-job training, which we call our OJT. This is another product where, again, employees can receive training on the job. The employer is provided a reimbursement for a percentage of the wage rate of the employee. So I think at this time we are reimbursing, I think, for 50% of the cost of that employee's wages during the time that they're in training. So again, this can be a great help to any employer or company that's looking to enhance skills but may not have the ability to support that on their own. And so we are a great source to refer to them to see how we can help them. Customized training is another product or training that we offer. And this one is more to meet specific requirements of an employer or a group of employers. The commitment that's required by the employer, however, is that they have to employ the participant upon successful completion of the training. So, if they go through a customized training, they must be employed and remain employed with that employer for a period of time. We also offer supportive services, and these are services that, again, if you're a registered client of either OMJ or the Department of Planning and Development through our training resources, we can oftentimes help individuals with limited transportation costs, interview clothing as they're navigating from training into the work environment. We can also help them with new, if they are newly employed, obtain the tools that might be necessary for them to be able to do their job, as well as uniforms if they're required to have those. So again, if you have individuals who, I've got a new job and, I can't quite afford the $100 for the uniform my employer is requiring, and they are a either OMJ registered participant or DPD client, they can access these services. And again, just a referral, and we can walk them through the process. And then finally, the other type of service we offer, which is very limited in its scope, but it's out there, so I wanted to share it, is our RESEA program, and that stands for Reemployment Services and Eligibility Assessment. And this program is designed to work with individuals who are receiving unemployment benefits, but they need to get reemployed, or the goal is that they can get reemployed before their benefits exhaust, or they exhaust their benefits. So we provide really intensive reemployment services, referrals to other agencies and partners in the community, again, with the goal to get them reemployed so that they don't experience a period with no source of income.
Burma, thank you so much. I don't mean to be disruptive,
Okay.
but we have to gloss through the next couple slides.
Okay,
so we can
I'm
get to
sorry, I'm
moving
too
on
long.
as well. No, it's okay. It's a
So
great
yeah,
overview.
just real quickly, here's some of the training services that we offer. Again, I won't go through them. These are all on our in-demand jobs list. So again, I'll provide that resource or that website moving forward. And then our eligibility for services. Individuals must meet all of these 5 in order to be eligible for service, legally authorized to work in the United States, 18 years of older for the adult program, again, the youth 14 to 24, registered for selective services, have a high school diploma or GED, and then they have to make less than, and right now we did change that, it's less than 200% of the federal poverty guideline. And that was changed so that we could better accommodate household size and individuals that may have make more than that amount annually, but maybe their household requires a larger expenditure of funds. So, and then again, the referral process, if you, and this should say, if you need to refer anyone, you can call and refer them to OMJ at the number that Darlene gave, 419-213-5627, or jobs. Thank you.
Thank you so much, Burma. And we'll definitely follow up with all of these resources when we send something out at the end. Really appreciate your time. And now I'll hand it over to Holly Miller from Ohio Means Jobs in Wood County.
Hi, everyone. My name is Holly Miller. I'm a workforce specialist in Ohio Means Jobs, Wood County. And the great thing about going second is Darlene and Burma did a fantastic job of reviewing all of our services. Every Ohio Means Job Center offers the same type of services. They just might offer them a little bit differently. There's not any right or wrong. It's just dependent on each center. So you already know that our services are designed to assist with reemployment, and all of our services are at no cost. You can go ahead to the next slide. This is just a snapshot of OhioMeansJobs.com. If you want to find your local Ohio Means Job Center, if you click that For Job Seeker menu, that will pull up an option to select your job center. You would select that. It pulls a map of the state of Ohio, and it will give you the contact information for each center. Yep, and go ahead to the next one, please. So this one just reviews some of our services for employers. You already know there's training out there for our existing employees or new employees that on the job training. Posting of job openings on OhioMeansJobs.com, access to resumes to try and help fill those open positions that an employer might have. And you can also, as an employer, utilize resource rooms, job fairs, and then most importantly too, if there are options where you have to be laying off, we do go in and talk about our reemployment services connect with our unemployment folks so that we can make sure that those job seekers are getting connected to the resources that are available locally for both those unemployment benefits and how to get back to work as quickly as possible. So the only thing I want to touch on with the resource room, just kind of going back to that question, you know, Jill mentioned Y211. We always say YOMJ. We're there to assist a job seeker kind of on a one-on-one basis. Yes, somebody can get online and do these same services at home or at the library. But if they're stuck on an employment application or they're trying to apply for unemployment, they're already stressed out and really not sure where to go. Having that second set of eyes and somebody to walk through step by step can really go a long way. And we can do that in person, over the phone, virtually, whatever works best for that customer. And these are just all the services that you can utilize in the resource room, pretty much anything employment or training related. You can go ahead to the next slide, please. So in Wood County, because we are a more rural county, we do a lot of information just on a one-on-one basis rather than through workshops. So that same information, resume assistance, going over pre-employment tests, connecting to those training opportunities, is just handled on a one-on-one aspect. Next slide, please. So each of these are just some training assistance options. We've learned about the on-the-job training and the ITAs through Burma. One that I will point out real quick, we do have a rural healthcare grant in Wood County. And that's just trying to upskill and fill some of those vacancies in direct patient care positions. So that's just a special grant that we are offering as well, just another avenue for training. Coming July 1st, we are taking our youth program in-house. So this is just a heads up that we still offer the program that was currently through our Wood County Educational Service Center. But those employment and training services for the youth are going to be coming to our Ohio Means Job Center directly. And then if there are any questions, here's just some different ways to connect with us, our social media pages, phone numbers, and then websites. And then if there are ever any questions, I always encourage people just to reach out to me directly. There's my name and phone number and email address. And then Mary DeWitt is our workforce administrator. She could not be here today, but she did want to make sure she passed along her information. We're more than happy to help out if there are any questions.
Thank you so much, Holly. We'll make sure to include all the contact information in our follow-up as well. Really appreciate you making the distinction too between some of the needs specific to Wood County and between Lucas County OMJ too. And last but certainly not least, we have Bonnie Nusser from Ottawa County, from GLCAP, Great Lakes Community Action Partnership, who is going to talk about some of the resources there.
Well, good afternoon, and I might seriously be least because I only have 3 slides. But I'm going to start with our referral process. This is a 1-pager and we call it our pre-screen form. I work with and I have career coaches in Ottawa County, and we're from the Great Lakes Community Action Partnership. We used to be WSOS, and we contract the CCMEP youth program that we call Ready to Work. And this is our pre-screen form. It could be found online. You can download it. It can be, you can download it and send it in. So it's fairly straightforward. The demographics that we can get off this piece of paper, we can almost guarantee eligibility. We contact the person back. Even if we just have a name and a phone number, we will call them. We work with 16 to 24-year-olds also, and we contract with the Department of Job and Family Services to do our thing, which is what, Holly and Burma, you did a fantastic job. So you kind of, what we do, again, is what every single county in this, state of Ohio offers. Again, just maybe a tad bit differently. This is our trifold brochure. Also can be found online at glcap.org. And so pretty much it's what it is, and it outlines everything that we do, the services we offer. We offer everything that everybody else does, it appears. One thing though, I think maybe our program is special in doing is we think it's so very important to keep, and the others may be able to do this too, but to keep wheels under people's feet, per se, to get them to school and to work. And so we do offer car repairs. And in the wintertime, tires are very important. So our program is able to offer that. So I wanted to put that out there. And lastly, I wanted to talk just 30 seconds on our Let's Talk. This is our most recent promo piece. We work with Tara State Community College on a demonstration grant through the Department of Labor. We were awarded a couple of years ago. We're in our last year for a Job Corps Scholars. This program, regardless of county of residence, it serves 16 to 24-year-olds also. And this is a spin-off, if you're familiar with Job Corps centers that are residential in nature, this is a spin-off on that. DOL put these demonstration dollars out there, competitively bid to see if that concept would work at a community college. And so we are demonstrating that it does, GLCAP along with Tara State Community College. So we're in our last year of this. Short-term training programs, 100% covered, even if they need housing, only because Tara did build housing this year, or actually, I guess this is the second or third year that they actually have on-campus housing that they can provide, so, which is kind of different. Our Job Corps Scholars program is out there, and also our Ready to Work. That's what we do in workforce.
Awesome. Thank you so much, Bonnie.
Very
Well, really appreciate everyone's time and attention to detail. Again, thank you so much to all of our presenters. So appreciative of all the work that you're doing across Lucas Wood and Ottawa County to make sure that folks are able to get connected to job finding resources and your help supporting employers as well. So appreciate everyone's time. We'll send a lot of follow-up materials, and this recording will also be available on our Vimeo page in a couple days here. So wishing you all a good end of the week, and thank you so much for your time and attention today. Also, if you have any questions specific to any of the presenters, you're welcome to email us back directly and we'll put you in touch. Thanks all. Have a good one.
Thank you.